name is Oijoy Montgomery. I'm a postdoctoral fellow at School of Nursing at UAB. My co-authors are Drs. Polinchik, Milner, Hall, and Petitian. I am presenting the results of modeling patients' risk for hospital-acquired pressure injuries during COVID-19, a retrospective study. Researchers and healthcare providers have quickly begun studying the evolving patients' outcomes associated with COVID to estimate the risk of the disease on organs and systems of the body. We know that one of the body systems that impacted by COVID is skin. One of the most significant skin-associated adverse events are pressure injuries, or we call pressure ulcers or bed sores. The aim of this study is to determine 8 risk factors which place hospitalized patients at higher risk for hospital injuries. 8 factors include age, race, gender, length of stay, risk of mortality, severity of illness, all patient-defined diagnosis-related groups, and COVID diagnosis. We conducted a retrospective descriptive analysis in an urban academic health science center located in the southeastern U.S., which is the third largest public hospital in the U.S. We included 23,093 patients, that representing all patients discharged during the first 6 months of the COVID pandemic, from March to August 2020. We found that among over 23 patients, there were 247 patients who had pressure injuries and 1,053 patients who had a positive COVID diagnosis. The first graph on the left-hand side showing that patients with pressure injuries and COVID stay in the hospital much longer than who did not have any. Graphs on the right-hand side show that patients with pressure injuries and COVID were rated higher categories of severity of illness and risk of mortality. Based on the generalized estimating equations model, diagnosis of COVID, age, male gender, risk of mortality, severity of illness, length of stay are statistically significant factors associated with pressure injuries. Based on our finding from this study, COVID patients required additional attention to the skin surfaces to prevent pressure injuries. Thank you for attending my presentation. If you have any questions, please feel free to contact me at aoyjai@uab.edu.